Buenas and half a day, and thank you all for being here. The Committee on Education and Infrastructural Advancement, Border Protection, Maritime Transportation, Guahan Preservation and Self-Determination, and Federal and Foreign Relations will now convene this virtual information hearing. Today is Tuesday, January 12, 2021, and it is now 15:06. For the record and in accordance with the open government law, public notices were sent via email to all senators, stakeholders, and all main media broadcasting outlets on Tuesday, January 5th, 2021, and on Friday, January 8th, 2021. Notice was also provided on the Guam Legislature website. Joining me today, we have the Vice Chair for Guam Department of Education, which is Senator Shelton. Thank you. Senators Mary Torres, Senators Telo Taidegui, Senator Tony Yada, and Senator Moylan. Thank you all for being here today. Before we proceed, the legislature has general rules of conduct that must be followed. The general rules of conduct are: all must abide by the rules of conduct and quality assurance standards. Please keep your video on at all times and ensure you are in a room with little interruption and adequate lighting, specifically to make sure the participant's face is visible at all times. The host of this hearing will mute participants until called upon by the chair. When called to speak, please ensure that you are unmuted and that you are speaking into the microphone. Members of the committee wishing to speak may indicate via the in-app feature in the chat box or by simply raising your hand, and I will call on you. The order of questioning will allow Guam Department of Education to present their plan, and then as we move on, we will wait for the other heads of the agency to go ahead and brief us on some of the issues on some of the items on our agenda, and I'll open it up for the panel of senators to ask questions, and then I'll ask questions last. The purpose of this virtual information hearing is to provide our community an update from the Guam Department of Education regarding the reopening of public schools, face-to-face learning, online and hard copy learning, as well as the availability of vaccines for educators and support staff. We will also discuss the status of students unaccounted for and home visitation efforts, and also the planning of interscholastic sports, particularly low risk and moderate risk activities. The committee will also provide a continuation of previous discussion with Guam Department of Education's Division of Special Education, addressing the unique needs of our students with autism spectrum disorder and other disabilities, particularly curriculum and instruction, the public-private partnership, and the independent education evaluation assessment for school year 2020 to 2021. Okay, today's virtual information hearing will discuss the following: face-to-face learning, school readiness, social distance, compliance, and healthy and safety protocols, vaccination of educators and support staff, online and hard copy learning, distance learning status and initiatives, status of unaccounted students and home visitations, interscholastic sports, and the status on special education curriculum and instruction. I would now like to invite the Superintendent, John Fernandez, to please move forward and introduce everyone that is present here today and their roles, and then you may proceed with the presentation. Thank you, Superintendent.
Half a day. Thank you, Madam Chairwoman, members of the Education Committee. And I'd like to just say Happy New Year to all of you who I haven't seen this year. And just really thank you for having this informational briefing because you're absolutely correct. We're heading into another chapter of our COVID-19 experience, and this one involving the reopening of schools, not just public schools, but also private schools and charter schools to face-to-face instruction. And I think it's very helpful, however we can get the information out to our general public, and for those who are listening to the hearing or who may want to come back to this briefing after the fact on the legislature's YouTube channel and so forth. So before we get started, I want to first introduce those members. We have numerous people on, but this has been a really complicated but very important task to get ready for the school reopening. So I wanted to take some time to just let the committee know who is joining us today. So we have members of our board, and as I indicated prior to coming on board, our chairwoman, Ms. Maria Gutierrez, sends her regrets, but she is really under the weather. Otherwise, she would be here. And so she is being represented by her colleagues on the board as well. We have vice chairman of the board, Mr. Mark Mignola. We have Dr. Ron McNinch, who is a board member. We have Dr. Mary Okada, who is one of our newly elected board members. I believe Ms. Feli Angel is also here and has joined us. She is one of our board members. And then we have, I believe on the YouTube live, she indicated she was watching Ms. Carla Borja, who is our board member and also chairs the Guam Advisory Panel for Students with Disabilities. And so she's been very active and wanted to let us know that she is also watching. As members of our team, we are represented by our deputies. We have Deputy Superintendent Erica Cruz, Deputy Superintendent Joe Sanchez, and Deputy Superintendent Zenny Asuncion, all who play a role in our planning and strategies for reopening, whether it has to do with the safety at our schools, curriculum and instruction, or helping with the financing for some of those efforts. I want to recognize also on the team Mr. Ike Santos, who is our federal programs administrator. A lot of what we are doing is really, luckily supported by federal funds that have been made available to support the purchasing of PPEs, the purchasing of technology, and support for also our private nonprofit schools as well. So additionally, we have, here, let me go through the members of our team. And you have Ms. Azurdi Rossetti, who is the principal of JP Torres, but also a part of our SPED advisory task force that is currently providing recommendations for addressing some of our longstanding challenges in SPED. We have Mr. Neil Rochelle, who is also from our special education division. Ms. Margaret Cruz, who has helped us as a chair of a co-chair of the committee, handling personnel issues as they relate to employees and their needs coming back to to the school year. Ms. Leilani Keone, who was our newest member of the team, I believe, our HR administrator, and she of course has assisted with those personnel issues. Dr. Zenny Natividad, administrator of our research planning and evaluation, who is part of our communications, as co-chairing our communications team, but really instrumental with the surveys of our stakeholders and gathering and analyzing that information. Assistant Superintendent Yolanda Gabriel, who is also here from SPED to answer some of these questions that have been posed by the committee. Mr. Josh Blas, who is a staff member with the CNI Curriculum and Instructional Division, and part of our team to help deploy a lot of the resources needed for our different models of learning. And joining him, of course, is Michelle Camacho, also from our curriculum and instructional team. We have Ms. Isa Baza, our public information officer, who is again co-chairing our communications team, and not just not just preparing and setting up these meetings, but also helping get information out to our community regarding the safety requirements at our schools, and helping parents and students understand what to expect when they return. Mr. Al Garrido's got two roles. He works in curriculum and instruction, and so he is handling our partnership with the governor's office in addressing internet access at home. But he is also in his other hat helping to prepare for interscholastic for high school sports. We have Julietta Kineni, who is the administrator for our school nurses. School nurses are going to play a very critical role, not just with the community response like they have to date, but also in our school preparation and response once we reopen for face-to-face instruction. We have John Waslowski, a principal of Talafofa Elementary School, who has been a key team player on our operations and safety team. And I believe he will be also helping give the presentation on safety later in this info briefing. Kathy Didinko is from our special education division. We have Ms. Doris Bukakosa from our student community outreach. Always forget the exact terms, but she's from our outreach division and also helps coordinate the services of our social workers. So she is here to, address some of the challenges we've had in accounting for students who've been difficult to reach. She is also principally in charge of helping distribute the PPEs to our schools. Um, in addition to those members of our team, we have Ms. Nadine Cepeda, who is our district psychologist and chair of our Committee on Social Emotional Wellbeing for our students and our employees. And that is a critical part of our reopening strategy to help our students and our employees make that transition back to school operations in the midst of this pandemic. Ms. Christine Taitegui was our acting HR administrator, and she is in our HR division, again, assisting with personnel issues. And Ms. Rachel Duenas, who is a senior state program officer within the federal programs division. And as I mentioned, joining her is Mr. Ike Santos. I also want to welcome, I know I didn't see him earlier, he might have just joined, but Mr. Peter Alexis Atta, again, one of our newly elected board members. So that's our team. We have a lot of information to present. And before we do, I wonder if the committee would allow for our vice chair to at least open up for our board.
Yes, and before we move forward, I'd like to acknowledge the presence of Speaker Terlahi. Thank you for being present. Go ahead, Mr. Superintendent.
So, Mr. Vice Chair, would you go kindly open?
Yes, absolutely. Hapidi, honorable senators, and Duncan Asidus Maasi for the opportunity to bring before you the GDOE team. As you know, many months ago, when this pandemic first had made its way onto our shores, the Department of Education has been at the forefront, whether it be assisting with food distribution or working with our nurses to go to the front lines to work with GMH and their counterparts out in the community. The Department of Education has also granted access to our school facilities to provide vaccines for our Manamku. And so, as you can see, the Department of Education has been leading the charge for many months. And if you recall, a couple of months ago, we were actually pivoting to open schools in December. And of course, that time came and went. The governor made a call that, it wouldn't be an opportune time for us to do that. So in the past couple of months, the Department of Education has been meeting with our board. I just want to thank our outgoing members who kind of spearheaded our committee, our Health and Safety School Committee, Mr. John Birch, who chaired that committee, Mr. Lawrence Alcario, and also Mr. James Lujan were also part of the board at the time. And so as you can see now that we have new board members, they've jumped in, they're on the saddle already. We've kind of been holding these heavy briefs on a weekly basis to allow them and afford them the opportunity to see the activity that's going on with the Department of Education. I, as a parent today, I had an opportunity to go to Agata Johnson Middle School to sit there as a parent for the briefing of my 6th grader. And I can honestly say I sat there and observed, and everything that has been reported in our committee meetings has trickled down to the parents that were at the meeting. All the information regarding safety, PPEs, safety distance, washing of hands. I firmly believe that we still got a couple of days, but we'll continue to tighten up. And I'm pretty sure that the department is up to the challenge in ensuring that the students who are opting to, and the parents that are opting to go face-to-face will have a safe learning environment. Of course, we have contingency plans, and I think that will be shared with you folks. There's just a tremendous amount of work that has gone to bring us to this point. And I want to thank the superintendent and his leadership team and everybody that he mentioned. It's not just one person that came through this. I can also say that the board has also given the superintendent guidance and support. And we've asked him to ensure that all the internal stakeholders and external stakeholders at the Department of Education had an input as to the plan that is being presented to you folks today. I know that, Senator, you had a tremendous amount of questions with respect to the opening of the school and things that have led us up to this point. And I'm pretty sure with this briefing, you would feel confident or comfortable enough that should anything go awry, that the department is ready and willing to address those concerns and those issues. And this is one community, and we're all in this together, as you say. But really, I can say that that the professionals that are behind this plan really thought out a lot of things, scenarios, And I'm pretty sure that now that we present the plan to the Guam legislature, should any questions come up, it will afford us the opportunity to maybe rethink strategy or to present to you guys how we would deal with these situations. So again, thank you for the opportunity to present the superintendent and his team. I'm very confident that they'll be able to share with you the responses that you have requested via the committee. And we look forward to a great 2021. And in a couple of weeks, we'll be submitting our 2021 budget for the review of the legislature. And so we're heavily working on that as well, just to give you a heads up. Thank you.
Thank you, Mr. Vice Chair.
So, Madam Chairwoman, what I'd like to do is we did provide a number of documents. I know Joe Sanchez will kind of walk you through what those documents are. But as you can tell, I believe your committee members probably will have access to it through the Google Drive. It not only contains our presentation, but a number of other underlying documents, our safety handbook, some of the survey results that we receive, the board resolution, and the dashboard that we're using to assess readiness and so forth. So there is a lot of information that's already there. What I'd like to do is be able to, if this works for the committee, I'd like to start with the board resolution, which I think outlines the main plan and set of recommendations that were agreed upon by the board as part of the strategy for reopening for face-to-face instruction. I'd like to briefly present the dashboard that we're using to monitor for school readiness and share with you what face-to-face instruction will look like from a numbers standpoint in terms of the enrollment that we anticipate to see at schools. From there, I'd like to turn it over to Joe and his team. They will present the safety presentation, and we really would like to have enough time for Q&A. So we definitely will not take it personally if you ask us to speed it up or to go forward and jump forward for a couple of seconds. We totally understand that, but it is a lot of information, and we're happy to be here as long as needed to answer your questions. So with that, I'm going to go ahead and let me start off with the board resolution, and I'll share my screen for this purpose. And I'm not going to read through it all, but I wanted to just use it as a reference point for all of those, for those members of your committee who do have the document. So the Guam Education Board passed resolution number 2020-11 at its December board meeting. And the resolution is entitled Relative to Supporting the Recommendations of the District School Readiness Task Force to Continue Distance Learning Options for Students through the remainder of school year 2020-21 and to allow for the safe return to traditional face-to-face instruction upon authorization by the governor. Now, the resolution actually serves as a good, concise history of the issue as it's affected the department. I'm not going to go into those details, but it maps out the efforts that have been in place since March of 2020 relative to planning for the closure of schools, for the reopening after the summer, and then for the reopening for face-to-face instruction. But what I would like to address are the recommendations that the board, in approving its resolution, also supported, so that you have a good sense of what it is that the board has authorized us and supported us in addressing. So we have a number of these recommendations that were included in the task force report and recommendations to the board. So number one is that upon the governor's authorization, GDOE will be ready to open for traditional face-to-face instruction in line with the guidance from public health and from the U.S. Centers for Disease Control, which include temperature checks, the use of face masks, washing and disinfecting of hands, frequent cleaning and disinfecting of surfaces, 6-foot physical distancing, and other protective measures for supports for families who wish to transition to either online or traditional face-to-face models. So obviously the governor did give us this authorization recently to reopen for face-to-face instruction starting on January 18th. And so we are prepared and ready to open for traditional face-to-face on that very same week. So that did come to fruition. The resolution was passed prior to the governor's authorization, but now that we have that, we are prepared to move forward. Number two is that DOE will continue to offer and support 3 models of learning for families, and this includes online, home learning, hard copy, and traditional face-to-face instruction. Now, there were a lot of questions about whether we were going to maintain all 3 models, um, or we were going to have everybody go back face to face, or whether we were going to eliminate hard copy. So I wanted to clarify that all three models will be offered heading into this second semester of the school year. So all parents and students are able to choose amongst those three options. We do have a plan to eventually phase out the hard copy model of learning, but we don't have a time frame for that because we'd like to focus on ensuring that we support the expansion of our online platform or have the students return to face as much as possible so that nobody is forced off of any of the models of learning. But we did want to just acknowledge that hard copy is a very challenging model of learning to support, and it doesn't provide as much instructional support for students as you might see under the online or face-to-face instruction models. So all three models will be provided. Number three, parents and students will be able to choose their preferred model of learning, and nobody is being required or forced to return to face-to-face instruction at this point. We wanted to really ensure that that parents and students felt safe to return, and so those who choose to go face-to-face instruction are doing so voluntarily as the best option for their situation. The students who return to traditional face-to-face instruction will be divided into cohorts and attend school on alternating days in order for schools to comply with physical distancing requirements. So what we're seeing under the face-to-face model is that in order to maintain the 6-foot distancing, we are using 2 cohorts at most of our schools, except for 3 schools, which are going to be doing 3 cohorts. And those 3 schools are Benavente Middle School, FB Leon Guerrero Middle School, and Simon Sanchez High School. The remaining schools will be operating with 2 cohorts of face-to-face instruction. And then, of course, we have students who are online and students under hard copy. Number 5 is that the first 2 weeks after the reopening date, which we started, which was January 4th, when we reopened the semester, was dedicated to teacher and staff training in order to ensure that schools are prepared to receive students safely, and then provide training to support social and emotional well-being, and also time for parent and student orientations. So since we reopened for the school year on January 4th, these past couple of weeks have really been for teachers and staff members to return in order to receive updated training on all of the safety protocols, requirements, responses, emergency response procedures, as well as receive social and emotional training in order to not just address the needs of students, but also to assess their own needs as employees coming back. Everybody has a situation that they've gone through during this pandemic, and so we wanted to ensure that we had a transition back to the school year and back to face-to-face instruction with those supports set aside for our employees. Number 6, that on January 4th, 2021, online and hard copy classes would commence. And so those have recommenced for those students on those 2 models of learning. And then classes for traditional face-to-face instruction will commence on January 19th at all GDOE schools, subject to the authorization by the governor. Since the governor has given that authorization and it is in line with our anticipated schedule, the week of January 19th will be our first week. And again, we will talk a little bit more about the schedule later on in this presentation. Number 7 is that GDOE will establish and maintain an internal contact tracing unit by trained employees who represent the first responders to any potential or confirmed positive COVID-19 individuals within the school setting, and who will coordinate efforts with public health to address GDOE's needs. As I mentioned, Julieta Kanani, our nursing supervisor administrator, is actually our key liaison with public health and has been able to keep track and support the nurses who have been on the front lines and who by virtue of being on the front lines have been receiving a lot of support and training from public health relative to COVID-19 response. In addition, our social workers and student attendance officers and other key staff have also received similar training and also received the opportunity from UOG to participate in some of their contact tracing training efforts. So with that capacity, as they return to school, we are working on finalizing a memorandum of understanding with public health to really outline the roles that our employees will play when it comes to contact tracing. But our effort there is really to provide an immediate response when we identify a positive case. And that means no waiting, no long wait time between public health confirming and public health responding. What we want to do is be able to initiate the response right away in order to start the contact tracing, and then we will hand off to public health at the appropriate time. And of course, this is being done with the acknowledgement and the agreement of public health pursuant to an MOU that is being finalized. Number 8, and I will show this briefly later, is that we will be using the DOE dashboard, which is basically risk assessment that's based on the CDC guidance and looks at 2 weeks of information in order to help us get a sense of where we are in our risk at our risk levels. And this is not necessarily different. I mean, it is different from the CAR score, but it is a separate assessment framework that it is consistent with the CAR score, but it's something that we had been using since the beginning of this pandemic, and we wanted to maintain that as our consistent method of reporting to our stakeholders as to where we were in terms of our risk assessment. So I'll show that briefly after this resolution. Number 9, in light of the health and safety challenges, we requested the board's waiver of the locally adopted end of the year summative assessments. And number 10, similarly, we are going to be working with our federal counterparts to request a waiver from the mandated federal summative assessments, which will be very difficult to implement given the current situation, the pandemic situation, and the different models of learning that kids are currently in. So those are the board did approve and give us a local waiver, and then we will continue to work with the our federal partners to determine what is allowable under probably a new administration, of course, and their leadership at the education department. Number 11, we did request the Guam Education Board approve temporary waivers of grading policies, the uniform grading policies that have been adjusted in partnership with our school leaders and administrators. Joe Sanchez can talk a little bit about that if we want to get into grading policy, but we realized that in the first semester, a lot of our efforts really were trying to get everybody onto a viable model of learning and to ensure access to students. And that was a very challenging start, the first 4 to 6 weeks. So the discussions about how to effectively issue grades to students was really a hot topic for the first semester. And we can share with you where we are in terms of grades for our students, especially our high school students who require that as part of their graduation journey. On number 12, we did have the board reaffirm the temporary waiver also of the uniform policy, attendance, and then instructional time and other requirements, including the service learning requirement as well. So this is really just to give the schools flexibility in how we were able to adjust during this pandemic situation. Obviously, we didn't want the uniforms to be a burden to students and families who might already be under some type of financial distress. We are concerned about attendance, but we did not want to use attendance as a way to penalize students who might have already been having difficulty, accessing our curriculum and our schools. So these were again temporary waivers of board policies to get us through this school year. Number 13 is that the board did provide and ask that the superintendent retain flexibility to respond to any immediate health and safety incidences that happen within GDOE. And of course, what we're talking about is as we go into the rest of the semester, if there is an immediate need to determine any adjustments to a school's hours, whether it's open or closed, all of those matters can be immediately addressed by the superintendent and not have to go to the board for authorization. So that is retained. Number 14, we are being directed to continue with the additional distribution of technology and internet access to support online learning. Number 15, we do plan to open community learning centers this month, hopefully later this month after we reopen for face-to-face instruction, to allow our schools to begin providing after-hour support to students who require additional support for the internet and for technology. Number 16, we are awaiting the governor's authorization, but we do have a plan to recommence our interscholastic sports for high schools. And that plan currently envisions 2 seasons during the remainder of the school year, beginning with low risk sports and then proceeding in the second season to moderate risk sports consistent with public health guidelines. And then finally, upon the concurrence of the Guam Education Board, we are going to continue to monitor the situation to ensure that we are able to provide a safe environment for learning, for teaching and learning, and also ensure that our stakeholders are well informed of any changes, any adjustments that need to be made during the rest of the school year. So I just wanted to, I know this was a lengthy set of recommendations, but that encapsulates most of what we generally recommended to the board and which the board supported in passage of the resolution. And we're happy to take any questions on that, when the right time comes. I've been referring to the GDOE school readiness dashboard. And so I wanted to take an opportunity to just really quickly show what that was for those who might not be familiar. And so we've been doing this on a weekly basis, and we will be increasing the frequency of the reporting. But what we've been doing is looking at the number of new cases and the positivity rate, and as they've presented themselves over the last several months, definitely since August to today. And from August until early December, we really were in the highest risk categories for both number of new cases over a 14-day period, and of course the positivity rate. Now, this risk assessment basically is a general risk assessment. It doesn't give you any instruction about whether or not to close or open, but it does say that when you are in a higher risk situation, you definitely have to impose and enforce your mitigation efforts, including all of the requirements that public health and CDC have been recommending. So on a good note, as of the end of last week, we were at 2.7% in terms of our 14-day positivity rate, which puts us in the lowest risk category. On the 14-day new cases, we are still in a higher risk situation. So there's still risk out there in the community, but it has been steadily declining and dramatically declining since November, which is, I believe, when it peaked. So those are the two indicators that we will continue to track, and especially the positivity rate, which means that for every test that's being, every 100 tests that are being given out, that higher the positivity rate, the higher the indicator of spread in the community. As of last week on the school readiness checklist, the distribution of PPE supplies was completed. The implementation of physical distancing measures, so all the schools have arranged their campuses and their classrooms to comply with the 6-foot distancing. We provided cleaning and disinfectant supplies. Again, all of these, the majority of these items have been purchased with our ESF funds provided by USDOE. Every school has had to update its school reentry plan, basically to be able to comply with COVID-19 and to ensure that for each school's facility, there's a plan of action to respond and ensure the ongoing safety of our schools. And then what is an ongoing item, but which will be completed shortly, is the health and safety training for all GDOE personnel prior to the opening of schools for face-to-face instruction. On the bottom right, we have the number of GDOE COVID-19 cases, and we have, as of last week, 122 cases that have affected GDOE employees, and then 1 active. Now, this is, of course, a very important statistic to keep track of. During the last several months, we've been shut down. So all of the numbers that you're seeing here are really indicative of what's gone on in the broader community. We have not seen any evidence of any spread within a school setting because most of our schools are shut down, and the teachers and staff who are there are not, are there either. Some of them are teaching online and not even present on campus, and otherwise, when they are on campus, are required to follow, the safety guidelines. So the 122, when we report that out, we did that because we did want to be transparent with our community and let them know that DOE is not immune. We do have situations where employees are impacted, but in many cases, the employee might have been not have reported to the campus for 2 weeks. And so the concerns and issues that are related to contact tracing or disinfection of the campuses are not as immediate or urgent as if they had been on campus the prior day. So, but at any rate, Julieta, our nursing administrator, and our staff working with public health have really had a lot of opportunity to train in terms of responding when we're aware of a positive case. Going forward, we do plan to expand this COVID-19 cases reporting mechanism so that we can provide an updated and real-time report of any situations, any incidences that are, or any confirmed positive cases that we may see at our schools, so that our community is aware if there is an active case, what school it's at, and can see the numbers and be able to share with us in monitoring the situation. So right now this is an overall number because we've been shut down and there really isn't a lot going on at the schools. But once we get into face-to-face instruction, I know that parents, the general public, will be concerned about the specific schools that might be impacted and will want to know what information is available. So we aren't going to be sharing, of course, personal health medical information, but we can at least provide general information so that parents, students, and employees are aware that something is happening, something has happened, and that measures are being taken to address that's the situation. So that's our dashboard, and again, we're going to be continuing to improve that as a reporting mechanism, and then hopefully, as we go along, people get used to the information that's being provided, on a regular basis. If we look at where we've been since August, this is basically where we're operating from. If we track those two indicators, the 14-day, this orange line is our 14-day number of new cases per, and then the blue line is the positivity rate. Since August, which is where we started, August 16th, which was supposed to be the first day of school, but we were shut down from then. This community has obviously gone through a tremendous traumatic situation with COVID-19, with the numbers peaking, around mid-November for both the positivity rate, which hit 14.6%, and then for the number of cases per 100,000 people over a 14-day period, which peaked at 880 new cases per 14 days. So where we are today, again, is much improved. And we do look forward and hope that the community will continue to help keep these numbers where they are, which again is a lower number of cases, a lower number in terms of positivity, so that we can provide an assurance that we are in a safer situation to maintain face-to-face learning. But this is basically where we've been. And in mid-November, it did not look like there was going to be any end to the situation, but we are happy to report that even through Thanksgiving and to date, we're approaching the 14-day period after Christmas and New Year's. We haven't seen any significant increase in the numbers, but we will continue to monitor this. And we have informed the governor that if the numbers do reverse themselves and get to a point where we have concerns about keeping our schools open, we do maintain the authority to take immediate action, and we'll obviously work with her should broader recommendations be requested of our DOE employees. Okay, and so basically, I think the final thing I wanted to say was, with that being said, we do have a task force that's been trying to address every facet of reopening, as you can see from the list of recommendations. If I could turn it over to Joe Sanchez, we'd like to do at least an introduction, an overview of what issues have been addressed, but also be able to provide you a little bit more detail on the safety measures at schools, so that not just you, but our parents who are watching can get an understanding of exactly what to expect when they return to face-to-face instruction, beginning next week. So if that's allowable, I'd like to go ahead and turn this over to Joe.
Okay, yes, go ahead, Mr. Sanchez, and then when you're complete, I'll open it up for my colleagues to have to ask questions.
Great, thank you. Thank you, Madam Chair, Hafaday Speaker Talahi, and senators as well. So I'm just going to be going over real quickly the task force so that you kind of know how the structure was for us with regards to our planning. as well as the documentation that's provided to you. I know it's a lot of information, it's a lot of documents, but we believe it would give you kind of a comprehensive idea of the not only the planning, but the information that has been shared with our community, both internal and external. The District School Readiness Task Force is comprised of 7 committees. The overall task force chairs are myself and Deputy Superintendent Erica Cruz. We have our largest committee, which is going to be doing their safety presentation right after me, is the District School Operations, Safety and Social Physical Distancing. That's headed by Deputy Cruz and Mr. Christopher Anderson and Mr. John Weslowski, who's going to do the presentation today. Curriculum and Distance Learning, Inter-scholastic Sports, District School Personnel Management. This is the committee that handles a lot of our personnel needs and teleworking and things like that. Social and Emotional Wellness, Communications and Public Relations, and our Finance Committee. In our packet today that we provided to you, we actually have 9 items that we shared, and we're not going to present everything today. In fact, we had a run through yesterday, and when we did our run through, it was actually 2.5 hours. So we figured, okay, that's not going to work. But all of these documents here really have that information, and you can kind of look through them at your leisure. The first document is, of course, the Guam Education Board resolution, which really summarizes the work of the task force and the major policy recommendations that we initiated and they eventually approved. Our COVID dashboard, which the superintendent presented. Our face-to-face estimates, which he also spoke about, but basically it's just a spreadsheet that shows you what our estimated numbers of face-to-face students are anticipating. One of our main documents for all of our schools and the district is our GDOE COVID-19 handbook. And that was provided to all of our schools. And just to give you an idea of what the schools do with that is they take that handbook and they really align all of their school safety plans to that particular handbook. Our 5th item is the reopening safety plan. That's the presentation that's going to be coming right after me. You have a task force executive summary. So if you wanted to just eventually skip to that, you get a summary of every committee and all of the major items that the committee worked on throughout the last couple of months. We have the PowerPoint presentation, which is here. And again, I'm not going to go through my whole presentation, but if you wanted to just get a further summary of the main items, you can look through the PowerPoint presentation. We also have a summary of the GDOE surveys that we provided to our students and our teachers and staff, as well as our parents. So we have quite a number. We have a summary here, and if any of those items generate any additional questions, we can provide further copies of the full surveys that were provided. And number 9 is not really a document, but it was a zip folder that I know Ms. Michelle posted onto the chat, where it's a number of posters and handouts that we provided to all of our schools. So at this time, if it's okay, Madam Chair, I'd like to go ahead and turn it over to Mr. John Weslowski, who's one of the co-chairs of the Operations Committee, and he will be doing basically our reopening presentation. This is a presentation that has been updated over the last couple of weeks, but we've presented this to parents, administrators, students, and just the community at large with regards to our overall planning and preparation. And I believe also it addresses some of the initial concerns that were put or questions that were included in our the agenda. So John, you want to go ahead?
Yeah, Mr. Sanchez, can you share the screen? I do not have sharing capabilities at this time.
Okay, I think Ms. Michelle, do you think you can make Mr. John Weslowski share his screen? Are you able to, John?
Yeah, John, you're the co-host now, so you can share.
Okay, thank you. I can share now.
Thank you.
Okay, so this is basically our plan of what we're going to do to go back to the face-to-face in the upcoming week or so. As you know, the COVID-19 is what we've all been focusing on, how to make sure that we can stay safe and ensure the health and safety of all our employees, the students, the teachers, and our visitors and all our stakeholders, because this is really a community effort. So our guidance in that is to, number one, is to ensure the safety of everyone. And we've been following the CDC guidelines, the public health guidelines, to determine how to come to school safely, with the emphasis on being equitable. We know students come from a variety of backgrounds, and we can't have equal for everyone, but we looked at equity as an important component of this. And how do we support our students, and then communicating that with you. With that, I want to share the timeline that we are following over the last month or so, including our stakeholder presentations, as was mentioned a few minutes ago. We've had those back in November, sharing with the stakeholders what our plan is, so that we want to be open, have that open line of communications. And I know the schools this week were doing their presentations to the students who are looking at coming face to face. And we also had our IBOG students available to represent the students. So it wasn't just the adults looking at how does it affect the students and for them. We did have a period of registration, or more of a selection, not necessarily registration, but a selection period for parents, so that they could let us know if they're planning to come back and if they feel safe. And then, as the Superintendent Fernandez had mentioned earlier, we had the training this past week, not only for our faculty and staff, but also for our parents and our students coming back. Starting on January 19th, our online instruction will continue that week. And then with January 20th and 21st, we'll be looking at our first face-to-face sessions with the students, assuming that everything stays on track as it is right now. As I mentioned, health and safety is our number one concern, and everything we will do with this is in regard to ensure that all students and our faculty and staff can return to school safely. With that, we have instituted physical distancing, and we say physical distancing as opposed to social distancing, because really we want our students and our faculty and staff and everyone to stay socially connected, because that emotional component is really critical. But having that physical distance helps to reduce and decrease the spread of the virus. With that, there is a extremely decreased capacity in the schools. As you can see in some of the pictures, our students have to be spread quite far apart. Even in the hallways, there's directional markers and there's spacing for that. Also shown is the face coverings, that everyone will have to wear masks and PPEs, and we will be screening all employees, all visitors onto campus to ensure to help reduce the risk of the pandemic spread. Here are many of the types of face coverings that can be used, including the gaiters. The only one that's not allowed is the face mask that has the valve in it, because it's more for preventing dust and debris coming into the wearer, as opposed to spread of the virus going out. And so it will let the air go out. So that one is prohibited, but all other face masks are allowed. These are optional items that students may bring. But they always must wear a face mask. There's no exception, but they may also have an additional face shield. They may bring hand sanitizers and disinfecting wipes, although those will also be provided by the schools for student use. As I said, health and safety is our number one concern. And so with that, we want to make sure that we disinfect and we clean, and we have very strong disinfection and cleaning protocols in place, especially in our shared spaces, our cafeterias, our classrooms, our playgrounds, and our classrooms. And there will be daily disinfection of all areas and with approved CDC cleaners, as well as cleaning of high traffic areas such as restrooms, doorknobs more frequently. Visitors on campus must wear a mask and will also be screened for the potential COVID with a temperature check. Monitoring doesn't start at school. Monitoring begins at home, and so when we speak with our parents, we let them know that you're our first line of defense to protect your child and the community, and that's by screening your child at home, by doing temperature checks at home and making sure they're feeling healthy. And if they're not, in peak condition, ready to go for school, just to keep them home and help them recover at home, even if it may not be a COVID situation. Recovering at home is better for the students than to be stressed out by school, at school not feeling well. If students do come to school and they test, get a temperature check with a positive reading above 100.4, they will be referred to the nurse and go to a quarantine room where the nurse will assess them further for symptoms of COVID-19. And then in those cases, the nurse will follow the protocols depending on the situations with the child, if whether they need to be referred for a medical doctor or going home. So the nurse will be doing that further assessment. If there are cases where there are positive cases, contact tracing will take place, and the schools will be keeping track of who's on campus so that if there is a situation that contact tracing can take place. So again, it's an overall plan of first preventing illnesses, and then if there is illnesses, mitigating the spread of the COVID virus. As the superintendent mentioned earlier, there will be 3 models of learning that will continue: the online, and that's the students using their computers and the internet to be able to access the curriculum. The hard copy, which has been ongoing while we were not able to do the face-to-face, where students pick up the hard copy papers on Friday and complete the work and return it the next week. And then of course the face-to-face, as which we want to start next week, where students attend class 1 day a week, and then they'll be doing the home learning, either using online resources or the hard copy resources during the upcoming week. Before, here's a slight model of what it looked like if we had did the 1/3 model, and whether it's the 1/3 model or the 1/2 model, which most schools are following. Basically, we'll be looking at dividing the students up by last names, for example, A to E, F to O, and P to Z. Remembering the fact that if family members have, maybe, for example, starts with an A, last name starts with A, and last name starts with an S, we're going to keep hold those families together in the same cohort group, that just for the convenience of the parents. So what does the calendar look like for our students? So on Mondays and Tuesdays of each week, and it's going to be the same calendar for each week. On Monday and Tuesday, teachers will be working with the students online with basically about 2 to 4 hours, depending on the grade level of the students, spending on time online with the classes, providing that instruction to students. Then on Wednesday, the cohort A, and like, for example, in Talapopo, which is a 1/2 model, the students A through L will be attending school. And then on Thursday, students with last names with M through Z, or cohort B, will attend the school. And then on Friday is going to be day for interventions with the students who are doing online or hard copy. And some schools will be doing some tutoring in school. A lot of that may be phone calls, making contact with parents, others just follow up with the students who need some additional support. In addition, on Friday, the food distribution breakfast and lunch distribution will continue, as well as the hard copy distribution for the students who are continuing on the face-to-face. Again, FBLG, BMS, and Simon Sanchez will be using the 3 face-to-face cohort groups. All other schools will be using the 2 cohort groups. And for the most part, the high schools and middle schools will be following the traditional schedule and not using the block. I think one of the schools, I can't remember which one, will be using the block schedule, but most will be using a traditional schedule. We have been reaching out to our students, and about a month ago, we had about 650 students we were unable to contact, but with the lifting up of some of the restrictions, our outreach team has been able to go out, and we've contacted over 300 of those students through our social workers or community program aides to visit the homes, find out which model of learning the students want to participate in, the families want to participate in, and then completing those forms and submitting those schools for processing. So that number went from over 650 down to 351. And this is as of Friday, so I'm sure that number has reduced even more since then. And finally, we're looking at contact tracing, testing, and vaccinations. With the Moderna and the Pfizer vaccines out and being distributed within the community, the schools are preparing the to go to the next level, and that's the high risk employees, and the faculty and the staff are among that. So the department is working with Department of Public Health on a memorandum of understanding, developing contract tracing teams, COVID testing, which is ongoing this week. And then hopefully soon we'll be able to get the vaccinations to the employees who choose to get it. But again, that's in coordination with public health to coordinate that distribution. With that, I want to thank you for taking time to listen to our presentation. And if you have any questions, please let us know, and we'll try to answer those best as we can. The team has really put a lot of effort into preparing to ensure that our schools are safe and healthy for our students, for our parents, for our faculty and staff, and for all stakeholders. So I want to thank you for this time today.
All right, thank you very much, John. At this time, I'd like for us to just open up to the other senators to ask questions as far as if they have any questions on the resolution or the plan presented to GDOE. And we'll start with Speaker Terlahi. Speaker, do you have any questions at this time?
Yes, just thank you everyone for this presentation. And I know that it's a lot of work that you've been putting in to get school started. The part of the presentation talked about cleaning and disinfecting that would take place, and is there adequate supplies that have been passed out to the schools, including PPE and cleaning supplies, and are the teachers going to be responsible for the actual cleaning, in the regular basis?
So the initial response is yes. PPE supplies and cleaning supplies have been provided to all schools, and these were really based on the ensuring adequate supply for employees and for students who attend school. So these include the face masks, the hand sanitizers, and cleaning supplies to enable for the frequent sanitization of frequently used surfaces. So let me ask Doris Bukakosa, who is charged with handling this, for any further details in response to your question, Madam Speaker.
Thank you, Madam Speaker, and senators. We have actually put out different sanitizers, disinfectants, and solutions to the school site for different purposes. Some would be just for spray cleaning, just simple cleaning of the classrooms as the students rotate in and out. There is also a little stronger disinfectant that was provided with an electrostatic gun and solution that would be used throughout the campus. And that was provided to the school site, so the school would be responsible for that. In addition to that, with the contract of cleaners, my understanding is they go in twice daily to the various areas and also spray down high traffic areas as well as highly populated areas. So those have been provided to the school sites, and again, keeping in mind face-to-face classrooms. So if it's just an individual teacher, they don't anticipate going in and spraying down regularly because it would only be the teacher in the classroom with no other individuals coming in and out. But to answer your question, yes, all of those have been provided to the school sites, and it will be up to the school sites to do the distribution at that level.
And Madam Speaker, further to your question, it is a team response. The teachers will be responsible for handling some of the more frequent wiping down of surfaces in the classroom as they go through the day. Our custodial cleaners will be there to provide that additional support during the day, and also they're actually the custodial cleaners that we have on contract are also responsible for addressing the disinfection of areas of the school should there be a positive case. So they will also handle that as well. And then of course the school support staff will have additional ability to support those cleaning efforts. but it is almost a different level of, responsibility to ensure the safety of our classrooms.
Sir, if I can add, each school is required to submit a school reentry plan to address the requirements of public health as well as the CDC requirements. And so the questions that you asked, the use of or the availability of PPEs as well as hand sanitizers and disinfectants for our school is part of the requirements and activities that was listed as part of the school reentry plan, which was submitted to public health last month.
So have all the requests for the schools been met? What they've asked for, they've been given?
The only thing that we do have pending are the water filling stations, which we are anticipating to come at the end of the month, and which will also include the installation as well as additional water filling, sink hand washing stations. The hand washing stations are going to be outside of the restrooms so that it's an easier access for students to wash their hands or even adults instead of going into the restrooms. However, the two pending items that we have again are the hand washing stations and the water filling stations that we had to order from off island, and we ordered these items since August.
All right, and so if teachers feel that they don't have enough supplies, they're going to take that up with their principals, and the principals should have enough supplies if they had put it into their plan, and if not, then they have to go back downtown and make another request.
Absolutely. Right. So what we did was when we worked on our formula in purchasing PPEs and other cleaning materials, we were doing a daily burn rate. So we were estimating, in fact, we were estimating 100% of our students returning. So obviously that the schools will have an excess amount of PPEs and whatnot. However, if they do run out or are running out, they need to work closely with my office so that we'll be able to replenish their supplies needed.
And the teachers have responded that they feel that they can accomplish this cleaning that's necessary in addition to the current task that they have.
So the only thing that teachers will have to take care of is their classroom, and then having their students assist in wiping down their desk and whatnot. However, the other additional cleaning vendors to take care of wiping down the high traffic areas, restrooms, and as far as the classroom is concerned, the only areas that we're asking our teachers to be responsible for is their own desk, as well as students cleaning down their own desk as well.
Okay, and then I know there's a lot of senators to ask questions. So just one more question, that is, so if you're only able to get in one dose to some of the faculty and staff before you open the school, does that provide some kind of protection to this staff, or are they pretty much unprotected until they receive the second dose? What are your findings?
Are you talking about the vaccine?
Yes, correct.
Oh, okay. So I mean, I'm not a doctor, but I'm a hypochondriac, so I can pass as a doctor. So even if you get can get COVID-19, right? Obviously, it won't be as severe as though if you did not take the vaccine, much like the flu shot. And so we are in the process. We met with the Physicians Advisory Group, Dr. Luis Cruz, as well as Dr. Felix Cabrera and the Lieutenant Governor. I am currently compiling a list of individuals, prioritizing them by age, 60 and above, 50 to 59, and so forth. And those are the individuals that we're currently prioritizing, who are school-based employees that will be working directly with students. But yeah, obviously, you still risk a chance of getting COVID-19, even though you do get the COVID-19 vaccination. However, the symptoms are a lot less than if you were not to get the vaccine.
If I could add.
Yeah, my question is more, did we purposely not want to wait for the second dose and before starting?
Oh,
No,
well, we were,
hold on, Erica, Madam Speaker. I guess the way I would answer that is that, you know, all of these plans have come together prior to any indication of vaccinations being available. So we really are relying on the central guidance from CDC, which of course is wear your face mask, wash your hands, and watch your distance between others. And that, you know, we believe that that will be effective, an effective way to mitigate in addition to all the supplies and other measures being taken place at the schools. But we do want the vaccinations to accelerate the vaccination availability to our school employees as soon as that becomes available. So, you know, it is our plan to continue to open as long as these indicators stay where they are, especially with that low positivity rate. And again, we have been working to try to accelerate the availability of the vaccines for our school employees. So we actually had a meeting as recently as this morning. We understand that educators and our school-based staff are on the second tier, and that right now we are on, I guess, 1C and working through the first priority tiers in terms of the age groups. But this Thursday at 2 p.m., because public health feels that we are right on vaccinations, that begin the vaccinations with our school employees, and they wanted an opportunity to just inform the community about the vaccines, to increase the comfort level and on the confidence level of employees to be willing to take the vaccines. So that'll take place at 2 p.m. For our employees. It'll also be on Facebook Live. And we are with you. We really want the specifics, the time and dates. We're not quite there yet, but based on their anticipated supply of the Moderna vaccine, they do believe that we're right. You know, we're very close to having that be made available. And so we're starting to work on the planning and logistics for staging that vaccination effort. So I just want to make sure you were aware that that public health and Lieutenant Governor are meeting with us to try to figure that out quickly.
Right. So yeah, so best case scenario though, the staff will only be vaccinated with one part of the two-part vaccine before the school starting date. That was my question.
more than likely, yes.
That's correct.
Yes.
More than
okay.
likely, yes.
And the board is aware of that. And okay, that's wanted to check that. And do you have PPE, I mean mask, for example, at the school to pass out for the students to take home in case they don't have enough at home? Okay.
So what we did was we ensured that we purchase face masks for students and employees. So students will be able to avail themselves of face masks should they not have any at home.
All right, thank you. Thank you, Senator Nelson.
Thank you, Speaker Talahi. Senator Shelton, Vice Chair of Education, do you have any questions?
Thank you very much, Madam Chair. Hafa-day, everyone. Thank you for being here and all the work that you're doing, getting us back to school. Thank you for your commitment. I think the speaker hit all the questions on the vaccine and you provided all the information. I'm thankful for that. And I wanted to ask about the modes of learning. So now that we are going to open up the face-to-face learning, is there still an option for students if in the event they switch to face-to-face learning and something happens like a spike in numbers or there's just a feeling of discomfort from them or from their families, will they be allowed to switch back to the online or to the hard copy mode at any time?
And I don't want to be redundant, so I'm going to have Lieutenant Joe to go ahead and give a response, just in case you have any follow-up.
Thank you.
So right now, we are anticipating, and unfortunately, we have to anticipate the possibility of closing down in some circumstances. So the schools are prepared to kind of automatically transition them back to online or hard copy if necessary. Now, whether or not they can just kind of switch back and forth, that's something we try to discourage as much as possible. That can be done at a school level, but it creates incredible havoc when it comes to scheduling. And we experienced that actually in two phases. We experienced that at the beginning of the school year. Unfortunately, we didn't start face-to-face, but in August. And then we experienced it in the middle of the semester when people were transitioning in and out. And, you know, they were moving from hard copy to online. And we understand definitely if it's a major concern because of the, the virus or an infection, or if there's a spike. But a lot of times the reason has to do academically. It's, sometimes it's too hard, or I don't like my class, and we get the a whole list of reasons. So basically, it's not no, but they would just have to work with the school and kind of confirm the reason for switching back. Because ultimately, what we want to do really is we want to get as many face-to-face students as we can, and slowly transition hard copy as much as possible to either the online program or the face-to-face program.
And Madam Vice Chair, in addition to that, I mean, I think the biggest constraint that we would have is those who want to switch and go face to face, all of a sudden, because obviously the key issue with the face to face is maintaining low enough numbers to be able to sustain the physical distancing requirements. So I think there is flexibility when it comes down to the school level, and we want to give the school administrators that flexibility. But of course, our message is you don't want to put yourself in a position where you then cannot maintain the public safety requirements. So we do believe that we are at low enough numbers with face-to-face instruction that will allow us to safely reopen, and I think we actually are going to benefit from that gradual reopening, so that we can make any adjustments needed at this point with those low numbers on campus before we think about expanding for more face-to-face instruction. So I think for those who want to switch to face-to-face, I mentioned that just because we do get requests from students, and we're saying, look, if hold on, and we don't want to start seeing a surge of more students going face-to-face in the middle of the quarter when we're still making those first week adjustments. In your packet of information, you do have a document, I believe it's document number 3, which is basically an estimate based on our latest information of the numbers of students you would see at each school on a daily basis. These numbers are still kind of changing in here and there, but for the most purposes, this is the number of students on the days that they are to attend who would show up at a school. So you can see that as a percentage of daily enrollment, you're talking about many cases less than 20%, or sometimes less than 10% of students who are, of your normal enrollment, who are going to be showing up. So again, with those low numbers, we think that's an opportunity to open up safely, and then to really make sure that we're making any modifications and adjustments needed to be able to further expand should we get to that position of being able to more safely operate schools later on in the school year.
Okay, thank you very much. And Deputy Sanchez, I know in one of our previous hearings, you talked about how you were developing grading systems for the different models of learning. And can you provide us with an update on that?
Yes, absolutely. In fact, we can, as part of our documentation, we can provide you a copy of the policies that were changed last semester to accommodate that. One of the challenges that we were having is, for example, deadlines were just kind of out the door. People were turning in, students were turning in different assignments at different times. Even with the online classes, there was a substantial amount of time that needed to be spent on the use of the technology. So really, the teachers had to work with a variety of levels within the same class, which meant the work gets turned in at different times. So I have to give them a lot of credit, because a lot of times too, that was also very differentiated, meaning even within the same class, you had a group of students who are working on different standards and different assignments at different times. So what we tried to do is we worked with the teachers. We actually had representatives from elementary, middle, and high school. And I'm not exaggerating when I say hundreds of teachers, because now with Zoom, you're able to have a meeting with 100 some teachers at the same time who can contribute input into kind of the best way that they can, policy can be developed. So we looked at our current standards-based grading system, and our standards-based grading system utilizes a rubric-based system, which is categories of performance. And what the teachers did is they basically took those categories of performance, level 1, 2, 3, and 4, and they clarified the definition for each one, with level 3 being a very broad category of the students meeting the standard. So the idea is if a student were to be classified at level 3, that means they basically turned in their assignments, they were correct, there were no, they were not missing, that many assignments, that basic criteria with whatever class they were taking. 4 would be advanced, meaning, they not only met the requirements of the class, but they went above and beyond. We do have some students who really took to the technology, or in some cases with the hard copy, they really do well with some of the material that they turned in. So 4 would be the advanced. And then of course 2 and 1 would basically be kind of just gradations towards the 3. So that was kind of a consistent agreement between all of the levels, from kindergarten all the way up to 8th grade. Another change that we had to kind of implement was that a large percentage of the teachers felt that we could not fairly assess them at the point of the quarter. So normally what happens is the semester is broken up into 2 quarters, and they have kind of like a summative end of quarter grade that takes place at first quarter, and then the second quarter starts up again. Because there were so many students who still had to turn work in, the teachers asked that we basically treat the first semester like an open semester, where we didn't penalize students for missing work in the beginning. They still had opportunities to pick up their assignments and do some of the work from first quarter. So that was consistent across the board from kinder to 8th grade. In high school, the only difference from that with the high schools is the high schools remained percentages. And part of the reason why they chose to remain percentages was because of the credit system, is they knew that students needed to receive credit. In some cases with the students who are graduating or who are vying for top 10 and for other awards, they wanted to make sure that they were consistent with their grade point averages. So the only difference was that they remained on the percentage-based system. But they did in fact do the same thing as kinder through 8th grade, where the first quarter was not considered a summative end of quarter grade, but more one big semester all the way to the end of second quarter. And just recently with the past board meeting, the board reaffirmed that we will follow that same process for every subsequent semester while COVID takes place. So for example, at the end, if the pandemic were to end sometime this semester, we would follow that same grading policy all the way to the end of this school year. If it were to end next semester in the fall, again, we would just finish out the semester with that grading policy.
Okay, thank you very much. I appreciate all the work that was put into that to help adapt and to meet the students where they are, and to make sure that we're still able to measure progress in the best way possible during these times. So thank you very much for that. And I know there are lots of other senators, but I'll just ask one more question if I can, Madam Chair. I know you mentioned, Mr. Wazowski, about that we've been able to visit the students in their homes, and the number of students who were not enrolled has decreased, and we've gotten them into the school system. I'm very happy to hear that. We were all extremely worried about those students being left behind, and so I'm wondering what will happen to these students since they don't have a whole first semester of grades in, as well as students who did not fare well in their first semester with online learning or hard copy learning.
I don't see John on, or
Don is on, but maybe Joe, you might want to answer that.
Yeah, that might be better for you.
Joe,
Yeah,
please
go
answer
ahead,
that
Joe.
question. It's more your field.
Yeah, I could do that. One of the things that we were very concerned with is we wanted to make sure that we were not punitive, not only in our grading, but in our attendance, and any of our approaches when it came to the models of learning, or even as they return to school. So a lot of our students, especially with the kinder through 8th grade, we're going to make sure that we do a substantial amount of assessment, not testing, but really getting an idea of where they are. For some of these students, especially the ones who have not been in contact, they're not we don't believe that they're not in contact by choice. I mean, we believe that they have, they live in circumstances that really make it difficult for them to actually participate in one of the models, which is why, the face-to-face model is so important, because it does give them an opportunity to come back to school. So we know that schools are planning to definitely welcome them, onto the campus, make sure that they are acquainted with all of the safety measures. We're going to pay a lot of attention to their social and emotional wellness, because, although they may be with family and they may be with friends in their area, we're looking at, how are they emotionally, with regards to coming back to the school. Are they fearful about coming back? Are they even aware of what's been happening in the last couple of months with regards to the virus and so forth? And then, of course, academically, is get an idea of where they are academically and provide whatever supports are necessary for them. We also know that although it was brought up, there was not a large support for the concept of retention or holding them back. I mean, right now, even under normal circumstances, retention doesn't have a very strong body of knowledge or research behind it, supporting it as a strategy. Retention, meaning, holding a student back at a certain grade, does have its pros in certain areas, but a lot of that have to do with age. A student who may be too young, entering a particular grade, or a student who's maybe coming from a different system that didn't have the background, the background foundation, but under most circumstances, it's not supported as an effective strategy. So there really has not been any push to consider retaining these students, but there has been a discussion about needing, heavy intervention, assessment and intervention, so that these students have the support to potentially, catch up when they do return to school.
Okay, thank you very much. I'm happy to hear that. We don't want any student to be left behind. So thank you for that work. And thank you very much, Madam Chair.
Thank you, Senator Shelton. And as we move forward, can you, my colleagues, just limit your questions to 3 questions? And then as we close up, if you have anything pending, then we can come back around. Okay, so Senator Taidegui, do you have any questions?
Thank you, Madam Chair. And I'll try and be brief. Erica, you mentioned earlier about the water station as well as the hand washing station. Sorry, the water refill, drinking water and the hand sanitizer. Is public health allowing you to go ahead and open without these in place?
Yeah, yes. So we do have a plan B for the hand washing stations are just something that's additional. It wasn't required. We do have restrooms with adequate amount of sinks available for the population that we have in our school. However, the water filling stations had to be touchless. And so the plan B that we have relative to the water fountains is that an adult has to be the one to fill the water bottles for the students. So we were fortunate enough to get a company to donate 28,000 water bottles to our students through the Foundation for Public Education. And so if the students do not have a flask or a water bottle, we will be able to provide water bottles for these students. So it will be an adult that will be filling the water bottles. The students will not have free reign of the water fountains like they once did before. They won't be drinking out of the water fountains. It will be through the water bottles that they'll be using. So that is our plan B as we anticipate the arrival of the water filling stations, ma'am.
Thank you, Erica. Daily masks, you'll have those prepared, these, I guess, disposable masks. You have those, you mentioned you have how about the temperature check? Will there be a temperature check like already?
So the process, so what would happen is that we are relying heavily on parents as far as screening their children as far as temperature checks, because temperature checks will not be done on the buses because of safety protocols. However, when the students exit the bus or their vehicles, their car riders, they will all get their temperature checks. Most of the schools have the regular temperature check the gun. But there are the schools with a larger population, they do have the cameras where it'd be easier to screen a larger amount of students versus just the regular handheld temperature guns that you see at small stores or other establishments.
Erica, so you
But
mentioned
that would be the initial screening, is that before they get on campus, as they enter a campus, that they will be screened. And if they do have a fever, then they will be sent to the nurse's office for further evaluation.
and then the buses, you mentioned earlier about the buses. With regards to that, I guess everything's in place, Mr. Superintendent, with regards
Yes.
to the distance. Okay, I think that was discussed a while ago and the last time. So nothing has changed from the other. Okay, so
Yeah.
just
So
for the sake-
we meet weekly. We meet weekly with DPW. They do have their protocols in place, 25 students maximum capacity on a bus. They do have protocols, cleaning protocols in place. The initial week or two, they will have face masks for students who may have actually come to school or come to the bus stop without face masks. However, that's not something that they're going to offer throughout the year. However, we do have that for our students. We have disposable as well as cloth face masks for our students to utilize.
And Erica, in the bus, where you picking up these students at the bus stop? That's another thing, because you can't stop these kids from all congregating right underneath the bus. I mean, are there areas there that shows them, okay, stand here, stand here, stand there? What is DPW doing with regards to that bus? And before I get, this is my last question, Madam Speaker, but I just wanted to bring up also Mr. Fernandez before that question is asked. It's very simple. The vaccine that's being distributed out right now in the States, they're actually giving this vaccine to people with comorbidities first, not necessarily 60 and up. There could be people with diabetes who are in their 50s, people with cancer survivors who actually are in remission, individuals with, certain comorbidities. So when you do with Dr. Cabrera, please ask them about our teachers who have those comorbidities, even though they don't reach the age of 60, that they're given this vaccine up front first, along with them. So, but anyways, on the budget.
Senator, Senator, on that note, first of all, with regard to the buses, there are actually two tie-ins, but with regard to the bus, we did meet with them, as I think earlier, was it earlier today or yesterday? I'm sorry.
Today, sir.
Earlier today, we did meet with the directors and his staff, and have met weekly just to ensure that they have adequate numbers of buses, that they have that they're prepared to adjust to some of the first couple of weeks of uncertainty about who's riding the bus. We shared with them our estimated numbers of face-to-face attendees on a daily basis. We anticipate that they will be publishing their schedule over this weekend, so that parents and families can have that bus schedule, so they can be updated as to the the safety protocols, as well as the time for pickup and drop off. And again, they are going to be maintaining a 24 passenger cat, and also provide face masks as well. It's my understanding the bus drivers will also be offered vaccinations as part of the frontliners. And then again, our educators and staff at the schools will be following shortly thereafter. So we do want to just provide that assurance that we've been working with them to coordinate. And then with regard to the vaccinations at the schools, we met with the doctors today and the lieutenant governor, and actually our recommendation was to push as much as possible towards a mass vaccination for GDOE employees, because we know there's going to be a lot of overlapping priorities, comorbidities, age groups, and so forth. But we also know that the federal government is pushing jurisdictions to vaccinate as many as possible. And we certainly want to be a part of accelerating the vaccination strategy. So our recommendation was, if they do get enough supply and we can work out the logistics quickly and provide our staffing support, including our school nurses and so forth and staff to support that, we want to get as many of our employees vaccinated, since they're going to be showing up at school every day. As part of the face-to-face instruction returning. So we definitely hear that message, and we continue to relay that.
Thank you, Mr. Superintendent. It's most especially for those with comorbidities, okay,
Yeah.
that need to be at the forefront. Thank you, Madam Chair, for the opportunity.
Thank you, Senator Tiedegree. Senator Torres, do you have any questions at this time?
Yes, I do. Excuse me too, my internet is a little spotty, but the question that I had, there was discussion about the uniform grading policy being suspended or being waived for this period. There's discussion about the different grading platforms, grading for the different platforms. But what I was wondering is, will the board also be addressing the suspension or waiver of instructional hour requirements, or will there also be a consideration for extending the school calendar to accommodate instruction that is needed or required by law or policy? So how is the board addressing that specifically?
If I, Mr. If I could just, we do have a curriculum committee, and that is supported by Deputy Superintendent Sanchez and many of the school leadership teams and administrators. So and let me ask if Joe is, in terms of the recommendations prepared for the board on those issues, if I may.
So, yeah, so actually the policies that the Guam Education Board has regarding the minutes, those have been waived within the board's authority. However, the instructional hours, those are part of the list that we would either have to request from the legislature or I don't know if it's covered under the executive order, but to the extent that the board has the ability to waive its own internal policies, those have already been waived. Those are the policies that talk about the number of minutes for each subject area in elementary school, middle school, and high school. But with regards to the instructional hours required by law, I think that would require an additional approval from somewhere.
Okay, and I think what many of us, while we understand we're under extenuating circumstances and there is not a desire to penalize children during the first quarter, I think, or the first semester, I think that the concern that we've discussed previously too was social promotion, and whether, because children are entitled to an adequate education, we also want to ensure that that they are properly promoted, right, or have earned the right to be promoted. So, I'd be interested to know what statutorily we would need to do to facilitate this unusual situation this school year, and possibly into the next. But I think also the other issue perhaps is the school calendar, and whether those considerations have to be taken into account to make up for lost opportunities to cover material and subject matters.
Yes, thank you. I think we'll go ahead and make sure we have further discussions with our board, because we do know that one of the challenges is extending the school year would require additional pay for teachers because they've already kind of fulfilled the required time, albeit it's not all students, because in the beginning you don't have all students kind of engaged, and there's still a number of students who may have missed. But with regards to their duties as teachers, they still kind of fulfilled that component. The other part too, and just to be upfront, a big concern that we have is the high schools, because in high school, as you probably know, there's no such thing as social promotion. In the middle school and elementary schools, because you don't have to earn credit, the students still can move on to the next grade level. In high school, on the other hand, there really is no automatic awarding of credit. We did do a form of that last semester when we first had the COVID situation. The difference is they've already completed half of the semester. So we were able to award credit based on the half that was completed. Unfortunately, moving forward, if a student has not earned the credit, there's really no mechanism for us to just automatically award it unless we were to remove a graduation requirement. So we are already thinking ahead about some intervention needs with regards to credit recovery for students who are in high school who may have lost the opportunity for whatever reason this year to earn high school credit.
Sidus Masi, I don't want to belabor the time, so I just yield to my other colleagues. But thank you very much, everyone, for the information. It's much appreciated.
If I just could close, Senator, with you on that line of questioning, though, I just want you to know we are concerned about those same issues. And I mean, first, I think in response to COVID-19, our primary challenge was access, was ensuring access for all students who, through an available, viable model of learning, and that's what we've worked to address. And our attention now is on the quality of that experience, right? The quality of learning. So that's the reason why we were evaluating whether all three models can be sustained. And like we mentioned before, the hard copy model is really a challenge to us because of what we know is a lack of as much instructional support as you would get in the other models of learning. But I think as we come out of this, and I'm hoping that we do come out of this COVID-19 situation with the vaccines and with other measures, the attention does have to be fully on the impact and the consequences of this past year. And I think what you're referring to is that, you're well aware that every state and every jurisdiction is going to have these same issues, as well as the institutions of higher learning. A lot of colleges have waived their SAT and ACT requirements, knowing that, it's been difficult to implement and there's a lot of flexibility is needed. But I think we're all going to have to be looking at what the consequences are and then how we help our students catch up. So we hear you very loud and clear, and we'll continue to discuss with our board.
Thank you, Superintendent. Thank you, Senator Torres. Senator Etta, thank you for being so patient. Do you have any questions at this time?
Thank you, Madam Chair. Yes, I do. Superintendent Fernandez, I know that you have PPEs, you have the cleaning supplies, you have all the proper protocols in place. Do you feel that you are absolutely ready to open next week, or do you think you need more time to be adequately prepared so that when we know our kids come back to school, that they're safe and the education can continue on as should be?
Yeah, I think with all the time and effort spent on really assessing the situation, I do have confidence that we can safely reopen. I do feel, of course, I would love to be in a position where the vaccines are all fully implemented and we as a community have reached that immunity level as a whole. But I think the other concern, of course, is that we do know that there are students and families out there for whom face-to-face instruction is a way to provide some essential supports to their kids. And so the way we approached this was never to minimize safety as any, it is our top priority. But we said that in the event that we get into a situation where that positivity rate goes low, and watching other jurisdictions believing that we could put the measures in place, we wanted to give our parents a choice. And the choice that the registrations that we've seen have resulted in pretty low numbers of those who do want to come back to face-to-face instruction, which will then give us does give us an opportunity to operate safely. And I believe the numbers that in that document will kind of give you a sense of what every school is going to be encountering. So for instance, at a school like League One Elementary, we're really talking about 34 students, expected on any given day, obviously spread out within grades and physically distanced. So I do think that we can safely operate, and we can then give ourselves a chance to improve our preparation and modification of our safety strategies while we have these type of low numbers. So again, the issue and concern would be if that positivity rate begins to go up, into that 5% range or above, we'll start to again monitor that and ensure that we take the necessary action. The other thing we're monitoring again is, what we're seeing in the community in other jurisdictions is that there might be a rising positivity rate, which is a concern, and you might see a high number of cases, but not that same high number of cases within the school system, just by the nature of how students, young students and so forth are exhibiting, their reaction and their spread of COVID. So that's something that we will be monitoring, because I think, once if we do have any indication of spread within the school, that will raise concerns and cause for immediate action. But, again, we're hoping and pushing on the vaccination side to accelerate that. And, we're glad to hear good news today that, we're ready to present to the community on Thursday, and by as early as next week, have that first dose administered. And we're going to push very hard to have our educators and our school staff, get to the front of the line.
Oh, that's great to hear. On the other side of the coin, there was the issue of the busing. And, I know you said the cap is going to be about 24, 25 students per bus. Is there a way that DPW would be able to, working with DPW to check the temperature of the students before they get on the bus instead of waiting till they get to school? Only because if we have a student that already has a high fever that gets onto the bus, we got a whole bus now that has to be isolated and checked and tested instead of avoiding the situation prior to that student boarding the bus.
Yeah, I'm happy to relay that again to them. Of course, that was one of our questions that we had for them. There is concern about the ability for their, they want their bus drivers to make sure they're not, clogging traffic, being able to get kids on and off efficiently. And they felt, I believe, that the temperature checks were not feasible. But again, it's something that we'll continue to discuss with DPW. I'm happy to relay that concern to them as we finalize our plans.
Okay, that's great. Madam Chair, thank you for the time. No further questions.
Thank you, Senator Anna. And thank you to DOE and all the hard work that everyone has done, down to our teachers and our staff, to preparing for the opening of the school. Just as a recap, some of the concerns, Mr. Superintendent, was what we just left off was Senator Anna having the temperature checks. And we will have a formal letter written to DPW to ensure what plan is in place and if it's really adequate for the transportation of our students. The one thing that was not clear on the briefing was the grouping scheduling. And so on the calendar, you have 3 anticipated cohorts for FB Leon Guerrero BMS and Simon Sanchez High School. And then you have 2 cohorts for the rest of the schools. And so are we just looking for Wednesday and Thursday for schools to be open for face-to-face in group A and B? And then where would group or the third face-to-face cohort come into place?
They will be on Tuesday, ma'am.
Tuesday, okay. So we're going to anticipate our students going to school on Tuesday, Wednesday, and Thursday for face-to-face. Is that correct?
Yes, with the Simon Sanchez, FB, and BMS doing face-to-face Tuesday, Wednesday, Thursday. The other remaining schools are Wednesday and Thursday.
Okay, and then we have the pie chart that has the separation depending on their last names, which you've also made accommodations for those siblings or family members that live in the same households. If they have different last names, they would still be included at a day where they can all attend school together. And so this is, you have your last names A through E, F through O, and P through Z. Are we identifying what day, what school they will attend, what day of the week they will attend school?
Yeah, and that would be worked out through the school administrator. They would determine, this is just a sample of what for our presentation purposes. However, if a family member or siblings have different last names, they are working closely with the school administrator to ensure that they're attending classes on the same days.
Okay, so every school will be different as far as the categorizing of the last names, correct?
Yes, and they will also work with the feeder elementary, middle, and high schools to try to ensure that they are all attending classes on the same day.
Okay, and then you mentioned that the high schools will be utilizing traditional schedule. And that means that they're going through, go through all of 1st through 7th period, all in one day instead of block scheduling. Is that correct?
So that will be to the discretion of the schools, and I will be able to provide you the model of scheduling that they have chosen. We do have schools that are on a traditional schedule. However, we do have some schools that are on a block schedule.
Okay, thank you. And then for item number 15 in the resolution board, you established internet services for community learning centers. Does this come from the federal grants that you received through the COVID funding, Mr. Superintendent?
Yes, they are supported with the COVID, with the ESF funds that are provided for the CARES Act. Yes.
Okay,
So
thank
we
you.
anticipate 21, our schools have indicated they would like to be community learning centers. And our plan right now is to get to the opening of schools next week, and targeting the week of the 25th to get some of those centers launched.
Okay, and then what are we doing for the online students that don't have internet services at their house? Are they, I know we had some issues in the first semester to get the community centers open for these students. And so I'm a little bit concerned about, you know, their growth as far as their reading capacity, their mathematics or arithmetic, and you know, science, and their English. So how are we, you know, Senator Torres had a very good point. How are we addressing the curriculum shortages when these students were not able to, you know, access online, the students that were still unaccounted for? Will they be?
So I think as Joe mentioned, we are going to be talking with our board about interventions and ways to catch up. I mean, again, you know, our first priority was access, and you know that 500 students that's now down to 350 was part of that access to education challenge. Those students were not connected at all. And then of course the online issues. We're right now in the procurement phase to get the MiFi devices, those types of, those mobile wireless devices, so that we can support internet access at home for more students. So we hope that'll help plug those gaps in terms of the access. And then again, as we turn our attention to the rest of the school year, into the summer, into next year, the focus on interventions and what it'll take to catch up. Those will be active discussions with our board and with with additional support from the federal dollars that we have.
Okay, thank you. And one of our concerns was also the vaccinations availability for our teachers and our staff. And that is a to be determined timeline, and waiting on the resources. And they are in the second tier, unfortunately. They were not included in the first tier of vaccinations. Is that correct?
That's our understanding, that they are the first group in the second tier, but you have to get through our age groups, comorbidities, and things like that, I guess. So we're hoping that on Thursday we'll have a more, when they have the town hall, we'll also be closer to a more definite plan and time frame for vaccinations for our staff.
Okay, and then for the, I have some stakeholder questions. So this actually just came in as we were discussing. Some of the concerns is that teachers are to log in activities daily, and they are asking if, well, this question is, can GDOE demand that teachers log in all their activities daily? What is the purpose of this in light of other educator demands?
You want to take a shot at that, Joe?
Yeah, I'm not clear on what that is, because
So
in terms
we're
of
not requiring teachers to log in daily all of their activities.
no, it's well they have to keep a record of the interventions that they provide, which is, I think, understandable, and the interactions that they have with both their online students as well as their hard copy students, because there has to be some accountability of the day. But yeah, we don't have a centralized system where they have to log every minute of the day. I think that would just be unreasonable.
Okay.
So,
and then for the teachers that, how are you balancing the teacher workload? Are all the teachers required to teach online, facilitate hard copy, and do face-to-face, or are you helping them to balance that workload where only certain teachers perform a certain type of instruction?
So we actually got criticized for being so flexible, but that question is exactly why we were so flexible. We met with the principals and what we call the school leadership teams. The school leadership teams are basically grade level representatives, department chairpersons, librarians, all the folks that would normally kind of be comprise leadership team at the school. And we basically gave them maximum flexibility with regards to the schedule. We showed them the pros and cons. Like, for example, one extreme could be having teachers teach a particular model, like some online teachers, some hard copy teachers, some face-to-face. The other extreme would have them teaching all three, which is very difficult to do. But basically, we made that a school level choice, and we kind of facilitated that discussion with them. So
Okay.
we really tried to make sure that they understood that any particular choice is going to have some pros and some cons.
Okay, and so
But the,
flexible in that those that are those that are doing face-to-face will remain face-to-face and not have to worry about online instruction. Is that what you're saying?
It
Well,
really,
it's
it really depends on
gonna
how the
depend on the school.
Okay.
So that's why we created that weekly schedule of Monday, Tuesday as online learning, and the Wednesday, Thursday for face-to-face students for schools who may have teachers teaching all three models of learning.
Okay. All right. And then I believe we covered everything, almost everything on our agenda. We covered the face-to-face learning. We're still pending a plan on how you will address some of the students who you were not able to be contacted, and how are we going to institute some kind of educational remediation for those that fall behind, right? And then the status of the unaccounted for students. We have over 300 now. What is the plan moving forward to find these students, to find the children and bring them back to school? Because the law, there's still truant laws in place and so forth. So parents still have to be held accountable for the child to attend school. So what is the plan moving forward to try to get a hold of these 350 some students?
So we're very glad that we have the authorization for home visits. So the day that those home visits were authorized, our team met and got right to work right away. I think we were at about 570 students at that time. So within a couple of weeks, we've been able to bring that number down significantly, just through being able to get our teams out there, to the homes. So really, that the strategy is to register them and then be able to hold them accountable. But what we were encountering, and the reason, with the students, was the fact that there was just no communication available. The phone numbers weren't working. The social workers combed through the database to find siblings. Same households with multiple families. They were being as creative as possible to try to reach out to the students, but there was just no contact. And then anecdotally, both the nurses who were out doing some targeted testing, late last year, and then our social workers through this round have found that, you have families out there who don't have the communication or the transportation means, and so just weren't able to send their kids, and didn't, at this point now with the buses running, we'll have a better shot at getting them to school. So Doris, I don't know if you want to add anything to that, since your team is the one that's out there.
Sure, sir, I can. So what we basically did is we did go out and do the home visits. We've actually brought that number substantially down. Lucky if we have over 50 still pending. Most of those actually not contacted now are due to they have moved from the original residence, and there is no information provided as to where they may have moved to, or no evidence of relocating off island, but that was the information provided to us. What we have done with those that we have contacted is, again, as the superintendent mentioned, registration. And of course, we're not forcing or coercing any family that you must go face to face, even amidst the challenges that they are experiencing. Because we respect the fact that parents may still feel very uneasy to send their children to school. So we discussed with them further the other two options, online learning as well as face-to-face. Hard copy. If they could commit to either one, of course, with the online, we presented to them that the schools were in fact distributing laptops and would soon get into supporting MiFi devices or internet connectivity. We did realize that the delays may again contribute to no, instruction going on, or still making those challenges as far as accessing learning or lessons rather. But again, we were not forcing anyone into a face-to-face model of learning. We will continue to work with those families who have not actually completed the forms, but like I said, we have less than 50, I believe. We'll have final numbers in the morning, sir, which I will provide to you and you can share with the legislature. We do think we will have that completed before the end of the week, definitely.
All right, thank you very much, Ms. Bukikosa. It's nice to see you. Mr. Superintendent, the challenges also with the questionable 180 instructional hours, that is in statute, and last school year we had to do a bill to mediate that. So, it's just a matter of where Mr. Sanchez says that you can cut the minutes in per subject, but you cannot cut the 180 instruction hours. So if there is an issue moving forward that GDOE feels that needs to be addressed, we need to discuss that as well.
Yeah,
And then,
I just wanted to, we'll go back and look at what was passed, because we had the same question about service learning, and it looked like, in the bill that was passed, that it applied generally so that it would have covered this year. So we'll have to take a look, and we'll let you know if further is needed.
all right, thank you very much. And now we are on item 5 of our agenda, which is the interscholastic sports planning. So I think that is Mr. Garrido, correct? Mr. Garrido, can you just please explain to us how GDOE is going to move forward, and how also will you incorporate those that are being homeschooled and those that are going to private schools into the sports, interscholastic sports? Thank you.
All right, thank you. Well, first off, we do have a projected start date of January 25th for our practices. Right now, we are currently hiring coaches and making sure that they're getting certified. We did also include an extra certification for COVID-19 that coaches will have to take this year. That's provided by NFHS.Learn. And we are also providing another extra training for them that will be provided this Saturday by our expert resources over at the Guam National Olympic Committee. Moving forward, we did switch to a 2-block system to make it a lot more easier to conduct sports. Currently, the sports that are being allowed under the current guidelines included running and tennis. So those were easy decisions to make. We have cross country up there first. And then there were other minimal contact sports, which also included girls softball and volleyball. Those were incidental contact, with volleyball, their opponents being on the other side of the net, and softball being incidental contact only a little bit of the time. So those are sports that we have going on this block 1, which is slated to start January 25th, and with games ending April 3rd. As far as participation with the private schools, charter schools, and so forth, we're still running the same way that we did last year. We're not going to really change anything. We want to keep it as smooth and simple as possible. There have been some inquiries for affiliations to participate in our sports. And so we're working out right now, if it's simple affiliations, we're going to follow our same rules that we had throughout the league, which is all a student needs to do is to meet with the athletic directors and get the forms and so forth, and they should be able to affiliate. There might be a little bit of difficulty that we're working out right now with IIAG because the sports are a little bit conflicting, but we should have that a little bit more clarified next week. I spoke to Terry DeBode, and I have a meeting this coming Thursday with my ADs, and he has a meeting this coming Thursday with his ADs, and then we're going to probably meet and come together and make a decision on some of the conflicts that might be coming up. We're working together to make sure we do this right for the kids. Other than that, we have our block 2 set up for moderate contact sports, which will start slated to start practices on March 22nd and to end on May 29th, right at the end of the school year. Those include, if you notice, we'll have a little bit more of the medium contact sports, which were kind of pushed later on, which are boys and girls basketball, as well as boys and girls soccer. And then minimal to medium contact sports, track and field, and boys baseball. So what we did is we're actually engaging the national federations. For soccer, it's GFA, Guam Federation, Guam Football Association. We're discussing with them ideas on how to run soccer safely, as well as for basketball. I've already touched bases with some of the GBC officials on how we should run boys and girls basketball safely as we come closer to those times. Other than that, we're just waiting, like the superintendent mentioned, we're just waiting now on approval from the governor's office to start our practices, and looking forward to getting these kids out there as safely as possible. One key thing is at the moment right now, probably the most popular question is, can parents watch and so forth? And at the moment, there are no spectators are going to be allowed. I already had communicated with some media outlets to have them come and attend some of the games so that they can have it broadcasted or published in the media so that parents can have some sense of participation for these games. So we're really looking forward to all of that.
Okay, thank you, Mr. Garrido. And there were some, yes, Mr. Vice Chair?
Yeah, Madam Chair, thank you for recognizing me. I know that we put a lot of planning into the sports program. I just want to, for your notice, that this year's budget actually, there was no money included for our sports program. And so our initial plan was to go to you and seek your support to help fund these activities, because initially I believe in the previous legislature that they weren't sure we were going to open school and we were going to implement these programs, but obviously as part of the plan is to roll out this. So just so that everybody knows that we'll probably be seeking your support to get some funding for our sports program. Thank you.
Thank you, Mr. Vice Chair. That was actually what I was going to bring up, was that, we were anticipating that GDOE would not open for sports. And so now we have to find a path on how we're going to be able to allow us to move forward and provide the funding necessary for our interscholastic sports. And there was also some concern with the transition from IIAG, the reffing contract, the referee contract, that this would cost GDOE additional money if GDOE took on the responsibility of their own sports. However, the board at that time and also members in GDOE said that it would not cost additional dollars for GDOE to take the sports. So now we just have to find out how we're going to find this money so that we can move forward with the sports. But I think that there's money there because we're already planning it, right? Okay.
Definitely. Thank you, Senator.
Thank you.
Madam Chair, Madam Chair,
Yeah.
just on sports, quickly on the testing aspect, because I know that was asked and we've been talking about vaccinations, but we are in active conversation regarding, even if we do the vaccinations, the doctors are recommending that we do implement, rapid testing as part of our ongoing strategy with employees and students. So that is another area that we are working on with public health. And then in particular, we do know that the doctors are interested in doing that, especially with sports. So, just as a further note, as part of our preparation, we are exploring rapid testing as part of our, ensuring the safety of our athletes during the sports season.
Okay, thank you, Mr. Superintendent. Let me just see real quick, I'll open it up for the other senator. Speaker Talahi, do you have any questions on the interscholastic sports?
No, thanks, not on the sports.
Okay. Senator Shelton, is she still here? Nope. Senator Torres? Okay, Senator Taitagui.
No, thank you. Thank you, Madam Chair.
And Senator Atta, do you have any questions?
None for me, Madam Chair. Thank you.
Okay, thank you. Just real quick, there was on our chat, just for the public is aware, there was some questions raised And the first one was by Speaker Talahi, and her question was, have the schools been equipped with adequate HEPA filters or CDC recommended air quality? So Mr. Superintendent, can you answer that question?
Yes, I know it was answered in the chat, but it also just for the members of the public, we are procuring the HEPA filters for the quarantine rooms, especially. But other than that, the schools have worked with our facilities and maintenance team to address any concerns about air quality. One school in particular where that is an issue is Simon Sanchez. So just if anyone was wondering why Simon Sanchez is on the 3 cohort schedule, it's because we are not allowing for the full use of the main building at Simon Sanchez, just because of the concerns that teachers had raised. So therefore, we're going to be using the classrooms in the quad and the outside of the main building area, which requires the school to go to 3 cohorts. So that is the one school where that was a concern that could not be addressed.
All right, and then there was another question, and I think our head RN, Mrs. Kaneni, responded, and the question was, will parents be promptly notified if a COVID positive case is found at the school? And that question was posed by Speaker Terlahi.
Yes, and the response there, and of course, Ms. Julieta's online, is the answer is basically yes. Not just for parents of that student, but parents of a student who tested positive, of course, would be the immediate contact. But we do plan to ensure that we let our general public know, including all the parents at the schools, know when there is a case. So that is, we do feel that it's important to be as transparent as possible so that our families and employees are well aware of the situation, of what we're doing to mitigate the situation, and are able to make decisions on their own as well with regard to their own safety. So that is our plan to ensure that transparency and immediate notification.
Okay, thank you, Mr. Superintendent. And so on the first 5 items on the agenda, do my colleagues have any questions on the first 5 items on the agenda? And then if not, maybe some of your members, Mr. Superintendent, can break away because we'll be in the final piece, which is the special education.
Okay, if that's the case, let me ask the deputies to stay on, and let me go, and we're happy to excuse everyone who is not part of our SPED team.
Okay, thank you everyone for being present, and thank you for your time.
Thank
Al,
you.
thank you, Al.
Thanks, Telena.
Could I ask one more question, Madam Chair, regarding I saw at the board meeting, they discussed plexiglass dividers were not available for the public schools yet. Are you planning to install those? We've all seen the pictures of the Dodea schools with the plexiglass dividers for the students. And what are your plans for plexiglass dividers?
So our plans for plexiglass are for all teachers, and for I believe there's we're looking at 10% for students, and those are for students who are unable to maintain, for one reason or another, the safety requirements, including the wearing of a face mask. So those are for particular situations where they may be medically necessary or recommended for additional safety measures. Otherwise, there will not at this point be plexiglass for each student. We did talk to Dodea about their situation and the choices that they made to go that route, even though it's not necessarily a requirement of CDC or public or any public health agency. And the reason we were told that they provided those dividers was because of their challenges in maintaining physical distancing within their classrooms because of the number of students that they were bringing back for face-to-face instruction. So in our case, with regard to the students, we don't anticipate that same challenge because of the physical distancing and the low numbers of students on campus. But we did go ahead and provide that additional plexiglass support for the teachers who are going to be there, and had expressed some concern, especially for those who might have their own health concerns and so forth.
Thank you. And so, Madam Chair, so the plan that DOE is implementing, public health has approved, and would you say these are CDC compliant, or?
Yes.
Okay.
Yes, we did follow CDC, and we did work with public health to review their draft guidance when they were in draft form, so we can ensure that we were in compliance. And then they don't necessarily do an approval, but our understanding is that public health is planning to do visits and monitoring visits to schools. So we welcome that as part of their efforts to ensure compliance. And that'll, and any modifications they recommend, we definitely will follow through.
Yeah.
Thank you very much, Mr. Superintendent.
They
Thank
did
you,
that
Madam.
at the beginning. They did that at the beginning of the school year in August. They did do school visits to ensure that the school reentry plans that were submitted by the individual schools are actually being implemented. And so we were told to anticipate visits again prior to or during the school year.
Thank you. Thank you very much.
All right, thank you, Speaker Terlahi. So if there are no more questions, we will move forward to talk about the special education curriculum and the public-private partnership that has been reviewed perhaps, and how are we moving forward with that?
Okay, so again, for those members who would like to go ahead and get back to work, you can be excused, but I do want to make sure our SPED team is here, and Yolanda Gabriel is, of course, our leader of our SPED division. And so if she's able to, well, if Mr. Rochelle, who is also online, one of the SPED staff, is able to share his screen, there is a brief response to each of those questions that we can work through.
Okay, we will give Mr. Rochelle the co-host rights. Okay, Mr. Rochelle, you have the ability to share your screen. Thank you.
Good afternoon, Senator Nelson and members of the legislature, as well as our GDOE leadership and my colleagues and stakeholders. Thank you for affording us the opportunity to share with you or provide you an update with regards to the GDOE special education. Next slide, please. So focusing on curriculum and instruction for the return to face-to-face, the special education students will follow the same procedures for selecting their models of learning. So we are, just like with the general education population, we are affording and our parents, our families to kind of elect the model of learning that they would like to access for the remainder of the school year. Students will follow the same cohorts as their peers in each school. So if it's a face-to-face on a 2-day, they will be following the same alphabet designation, and also the flexibility for siblings or family members that may have a different last name that would be afforded to them. Also, the programs for the students are dictated by the students' individualized education plan. And as you could see, we would like to also to share that the special education teachers and related service providers will provide students with a model of learning selected for each student by their IEP. So if related services is for the face-to-face students, we would like to work on how we are able to better accommodate them. It may be challenging because if there would be like 3 to 4 schools for our related services to be providing the service on the given cohort day, our related services personnel will work with the IEP team to identify and accommodate so that we are able to provide the related services. Next slide, please. So just to give you a brief breakdown of the number of students that are identified for students with special needs and also their model of learning, I just would like to inform that this data is fluid because it changes from time to time. So we have the total number of students that are identified receiving special education services by school, and the breakdown on the model of learning that they have. So for the first, for this current slide, we have the elementary schools listed. Next slide, please. To continue, the other schools. Next slide, please. Then we have the middle schools for the breakdown. And next slide, please. The high schools. And next slide will provide you the general information for the total number of students within the Guam Department of Education that were identified receiving special education services. So there are 1,753 students identified with special needs. Of those, 460 have elected to access instruction, and there are 460 of them. Home learning hard copy, total of 644 students across the grades K to 12, and traditional face-to-face is 518. So we have identified here the pending model of learning, and to date, it doesn't mean that they are all like a no contact, because from the information that we have gathered from the most schools up at this time, parents are not yet they have not registered their child or have not chosen for the model of learning. So this 131 students from K to 12, our IEP school team personnel are following up on these students to determine what model of learning that they're going to access on. Next slide, please. So what are the accommodations and precautions being taken care of? So no different from our general education population, safety protocols are set in place by the district, and each schools have their own reentry plans, and as well as safety protocols to kind of have that particular flexibility on how they're able to provide accommodations and some protocols to be taken place in each schools because of them being unique to with each other. So it's a known fact that most of our staff participated in the district training for coping with fear and anxiety returning back to work that was provided by our GDOE EMRO office. At the beginning of the school year in early fall, training was provided to all staff on proper hygiene and safety precautions. And order, as had been shared by our colleagues earlier. With regards to students unable to wear masks, they are currently being identified and individual safety plans are being discussed by the IEP team and school administrators. I have also asked our district health administrator to be also with us at this time so that if there are further questions regarding students not able to wear a mask, it could also be addressed within the purview of the medical need. Now, during the Christmas break, one-to-one aides were provided professional learning in order to better support our students. So they were provided training on how to work or infuse technology in providing support to our students, as well as the IEP process and the team collaboration. Earlier, I did make mention that each school has a re-entry plan shared with all the related services, considering the fact that most of them may be assigned to 3 to 4 schools. And with reference to transportation, what is different for those students, special needs students that are accessing the transportation service is that prior them boarding on the bus, the special ed bus, their temperature will be taken, as well as each bus driver or our transportation program unit office is communicating with schools on where would be the appropriate drop-off for these students. Teachers and aides continue to access an online applied behavior, and those with students needing special accommodation will have more specific plans discussed by the IEP team involving their parents. Next slide, please. So with regards to private-public partnerships, we have listed here. So for the applied behavior analysis that support for our students with autism, it is in progress. So it's a continuing work that we are going over and implementing. So a request for proposal was published to provide a private partnership with the applied behavior analysis support. Currently, the contract was approved, and my division or the Division of Special Education is just waiting for the notice to proceed in order for us to communicate to the organization that would provide the support to GDOE. Mentioned also earlier that there's a continuing online professional development focusing on applied behavior analysis. Our community partner, the Guam Advisory Panel for Students with Disabilities, we meet on them on a monthly basis, and parents are provided the monthly opportunity to be provided an update from the Division of Special Education, and also allow us to kind of receive or sometimes provide feedback to them. And we're currently, they are involved in working with our stakeholders in preparation for our submission for the annual performance plan report that is due February 1st of this year. With regards to ongoing professional collaboration with the following organization and agencies, we continue to work with the University of Guam CEDARS to kind of provide that level of support to our schools with reference to instruction and strategies and techniques. We have the National Center for Systemic Improvement, an OSAP-funded technical assistance center, to which we meet with them and work with our island partners. So we meet with the other island entities such as CNMI, FSM, Palau, American Samoa, and we work and they provide us that some sort of guidance and continued support as it align to the work that we all do. We also have our continued support from the National Technical Assistance Center for Transition, and this is focusing on the secondary transition or the high school students. We also work directly with the Early Child Technical Assistance Center, we call it the ECTA, that are focusing the work and providing resources and guidance for early childhood and elementary students. And of course, you know, the monthly work that we do with the Office of the Special Education Programs that provide us the continued guidance, as well as resources that will help on how we are able to work with our students during these times. Next slide, please. So for the last information that was kind of identified is to provide a status on the Independent Educational Evaluation Assessment for school year 2021. Currently, we have no pending requests for outside evaluations. So that ends the very brief status report that we would like to offer to everyone. And I am open to any questions that you have. If one of the questions is regards to one-to-one aids, currently with the number of students, the over 500 students that were identified as face-to-face, out of those a little over 500 students, there are 139 students with special needs with one-to-one aids that have elected to have the face-to-face model of instruction. Currently, we have a total of 360 students. So it appears that as of this time, there are like 31 one-to-one aides that have elected the face-to-face model of instruction.
All right, thank you, Mrs. Gabriel. I appreciate the presentation. At this time, I'll open it up for questions of my colleagues. Speaker Terlahi, do you have any questions? No? Okay. Yes.
Yeah, just for the students who did not elect face-to-face, who are supposed to have one-to-one aides, are they seeing these aides at all? I guess not at home. They're just staying home, so no need.
So for the online students, that are identified as special needs, they see their one-to-one aides online also. So they participate during the online instruction. And it depending on how the plan is made for that given week, there would be some sort of additional time for the one-to-one aide to kind of check on with the student if there will be some sort of help that they need for their assignments or homework. So it may vary from student to student, but if they are received online instruction, then they are also participating in the class. With reference to the hard copy students, so the one-to-one aide would be getting the guidance and direction from the assigned classroom teachers in the preparation of the hard copy packet. So there will be some sort of a process or routine on how this is being disseminated to the student and how it's going to be received back, as well as support to the teacher on how to kind of, go over the material that was completed. So it is somewhat, it varies as well as the type of student that we have. So we leave it up to the school team on how to better provide the appropriate access for the students to receive instruction and related services.
Thank you, Ms. Gabriel, and thank you, Madam Chair.
Okay, thank you very much, Speaker Terlahi. Senator Atta, do you have any questions?
Thank you, Madam Chair. I don't have questions of the Ms. Gabriel, but Superintendent, I was listening to the presentation and how she said that temperature checks will be done prior to boarding the bus. And I think we need to go back to DPW and see what we can do to work with them. I'm sure that there'll probably be additional drivers that will be available, and perhaps 2 drivers can go on one bus and one take temperature while the other's driving. And I just find it important to do that so that we don't have a bus full of infected kids coming to school, or, if we can prevent it from happening, let's do everything that we can to do. And if we, just one student, that's all it's going to take is just one student to bring an infection to school, and then we're going to have to close down the whole school and, go from there, right? So I think working with DPW would be able to, let's see what we can do with Mr. Ariola up at DPW.
I think sir, the big difference between special education and DPW buses is that special education typically has 3 students, and they pick the children up at their homes. And so doing temperature checks are easier because the parent is there and they're able, if the child has a fever, then obviously, they don't load the bus. Versus DPW, they're, and obviously we will go back to DPW and pose that question about temperature checks, but, they're picking up students on main highways and, taking their temperature. It's going to clog up traffic, but also it compromises the safety of the students because the bus drivers are supposed to be focusing on driving the bus, right, and not taking temperature checks. And that's something they've told us that from the beginning, is that safety is paramount for them as far as ensuring that the bus drivers are focused on their driving and not taking temperature checks. But that's the biggest difference between special education and DPW buses, is that the students are picked up at the home, temperature checks are taken, and the parents are there to help load their child on the bus. So it's easier with special education versus DPW. However, we will bring that up to DPW when we meet with them again.
Yeah, thank you. And that's all I'm asking, is just see what we can do to work with together and to, prevent any student that has a high temperature from getting into the school or on the bus. But, whatever we can do, let's try to do it, and let's just have a safe school year. Thank you.
Okay,
Thank you,
we'll
Madam Chair.
definitely relay that. We'll relay that to DPW as well.
Thank you, Mr. Superintendent. Appreciate it.
Thank you, Senator Atta. Mr. Superintendent, I do appreciate his input because I understand that we will be processing a lot of students onto the bus, And there was discussion earlier that when the buses reach the school, then that is when the temperature checks would be put in place. So is that process still there for the temperature checks when the students come to school? Okay, very good.
Yes.
Yes, we'll work with
Yes.
DPW, but absolutely when they get to school, the temperature checks will be implemented. We'll see if they are, are willing to reconsider and provide a solution for temperature checks on the buses. They did express those concerns, but of course, we'll go ahead and can relay that concern and see if we can revisit that. And then I think the other issue, of course, is, as you know, if there is a temperature situation, the thing is, we can't leave the kid at the bus stop, right? So we're going to have to also find out what would happen if there was a positive. How do we address that within the bus and get them to school so that we can then contact the parents? But again, we'll bring that to their attention as well as part of this discussion.
Okay, thank you. Okay, we got sidetracked a little bit. Back to special education. Mrs. Gabriel, what kind of training did the teachers and the one-to-one aides receive to help the parents or the guardians that are, caring for the children, caring for the students? What type of training did they have to help these parents or guardians to facilitate instructional learning to their child?
So with reference to online learning, that was included during their training just recently in December on what are the strategies that a paraeducator is able to provide support to the students and specifically tailored to online learning. So they were provided those various strategies and techniques, as well as how does it differ for face-to-face. So that training and support was provided to paraeducators. I just would like to add on also that since the beginning of school year 2021, on twice a month, we conduct parent training, and normally typically scheduled after 5 o'clock. And I'm just pleased to share with everyone that we have some major successes in providing parent trainings after 5:30 with this mode of engagement compared when we're doing it on site. So sometimes we have between 30 to 40 parents that join us on a biweekly basis. And we started off in August with related services. And during this bi-weekly parent trainings is to provide that level of support to the parents on how they're able to provide assistance and support to their child or their ward. So in doing such, we have add-ons in summer that we have started a family support plan that is documenting, and considering the input of the parent, what would be the best time to kind of do a follow-up and have the engagement with them, some sort of a follow-up with their child, and also making, the availability of staff, even classroom teachers, the support and assistance to the parents. So ongoing training for parents also is being held on a bi-monthly basis, so at least twice a month.
Okay, and understanding how the role of a one-to-one aide in a general classroom environment, the one-to-one aide is usually there, physically there, to keep the child focused on the classroom instruction. How does the one-to-one, what role does the one-to-one aide play when they're online and the student is not able to be focused and pay close attention to the online curriculum that is being given to them?
So typically, the aid is provided the strategies, and of course, there should be always a coordinated effort that is kind of initiated by the classroom teacher. So especially if the mode of delivery of instruction is Zoom, so our teachers make use of the breakout rooms So if a general instruction is taking place and there will be some sort of independent work, then that aide and that the student can be assigned a breakout room for only a short period of time. And of course, the parent is also with the student, so there's always like the supervision of the parent when this is being made. So there are specific strategies and techniques, and we would be willing to share that particular resource because it specifically line up the different ways and different scenarios on how support is provided to the student by a paraeducator. So
Yes,
that was provided to them.
I would appreciate that. If you can send the committee the strategies and the support that, that you're providing for the parents. My concern is what if one of the students are, have emotional disability? You cannot keep them focused on the computer, and the aide is not going to be able to coach them over the computer monitor for them. So in those instances, yes, please provide us with the information on how you're supporting the parents. Maybe, I know that the aides are being federally funded. Are there any type of support or financial support for parents who are physically there with their child, if that is even an option, if there's any federal grants available for that? And then also okay, I think that's it for now. But I'm glad to see that we are moving forward with some of the ABA applications for autism. And then also, I would like to have in the future another informational hearing or perhaps a roundtable on how we are addressing early childhood technical assistance, because there are a lot of areas that Guam can improve on for early childhood education. And I have been speaking with a lot of stakeholders, and there are some concerns about the amount of effort being given for early childhood education within Guam Department of Education. So that is just a pending item, Mr. Superintendent, just because it was brought up in the public-private partnerships. And then I think that's all the questions I have for now. Is there anyone else that, any of my colleagues that have any other questions that they'd like to address just as a whole? I see you raising your hand, Mr. Superintendent. Okay, go ahead, Mr. Superintendent.
Just on that note, I do appreciate that interest in having a further discussion on early childhood education. I know that does involve our SPED division, but also Head Start, and also we had an initial push to expand pre-kindergarten, and so we definitely would love to. We haven't been able to further expand that our pre-K classrooms because of some of our financial challenges. But I do think it would be right, and especially I believe the incoming Biden administration is putting an emphasis on early childhood. So perhaps there might be additional federal funds available to support these efforts, because I think the idea would be if we could expand the number of pre-kindergarten opportunities to more children, and then address the quality as you're referring to, it would make a difference in helping our kids get on track. So for K-12 instruction. So definitely we're willing to be there at the next opportunity.
All right, thank you. And if my colleagues don't have any questions, okay, I'm usually looking at Speaker Chalahi because her hand comes up real quick. Senator Ada, do you have anything that you'd like to comment, or do you have any questions?
No, none, Madam Chair. Just to thank the DOE staff for coming out and giving us this informational brief. And thank you, Madam Chair, for conducting it. And it gives us at least a head start as to where we're going to be at next week, and good information. Thank you, Superintendent, and everyone.
Thank you, Senator.
Senator Ada. Speaker, is there anything you'd like to comment on, or okay? All right, everyone, thank you so much for the enormous amount of work that you did, and thank you for coming into this informational hearing. I was trying to do it right before we enter schools so the public is a little bit more aware of the many efforts that you have done to prepare our students and address a lot of the safety concerns that the public has in this forum. Thank you, Mr. Superintendent. Thank you, all the deputies. all the division heads and all the teachers and staff for the amount of work that they put in. I look forward to discussing the budget. I see that there's a lot of issues that we're looking at for the resources that DOE needs for the budget that we need to address. And yeah, this was a great informational hearing. Good luck when we start school. And if there's anything that you need, any additional push that we can give you to assist you with other agencies to ensure that they are providing the resources to help you bring our students back into the classroom, please don't hesitate to ask this committee. All right, thank you very much, everyone.
Happy New Year.
Happy New Year, everyone. It is now 17:45 and we will call this meeting adjourned. Thank you. Have a good day and be safe.
Stay safe.
Thank you, everybody. Thank you, Speaker. Thank you, Senator.
Thank you.